right. Good afternoon, ladies and gentlemen. This is episode number 2 from Ahmad Talks. I have the honor to have with me Dr. Snooze, Dr.Dan Gartenberg. You're going to have to tell us why you're referred to as Dr. Snooze later in the episode. A small background about Dr. Snooze. He has a mission. He would like to heal the world through improved sleep health. He's the founder, CEO of SleepSpace. He has a PhD in psychology. He's an inventor, a professor, and my favorite part is he's a biohacker as well. He's been also a TED resident and a sleep coach. So again, welcome, Daniel. I really appreciate you coming in.
My pleasure to be here. Thanks for having me.
Yeah, and I like the lights behind you.
Got to be on brand all the time.
Yeah, exactly, yeah. So I guess the first question is, how did the Dr. Snooze name came to fruition? How did you earn that thing?
Oh, that was actually my TED residency. They just jokingly started calling me Dr. Snooze because I was talking about sleeping all the time. I guess that was back in 2017. Took the Instagram handle, and that was that.
There you go. My first question is going to be a bit global. So I recently read a book called The Messy Middle. It pretty much described the entrepreneurial journey, starting up a company and the end result, which is either a failure or a success. But we never hear about what happens in the middle, the ups and downs, the pivoting, multiple MVPs, minimal viable products. Can you tell us from your own lens, how did the messy middle look like for you?
Yeah, and by the way, I have that book on my bookshelf. I think it's Scott Belsky.
Scott Belsky, yeah. He has another book called Make Ideas Happen To, which I'm reading right now.
Is that a new one? Or?
It's the first one.
Oh, okay.
Then the messy middle came afterwards.
No, yeah. So it is a messy. I feel like I'm in the messy middle right now.
At the moment, okay.
Yeah. So we've been making sleep. I've been making sleep tech since I was in grad school. Back when the iPhone first came out in 2000, it came out a little bit before this, but I was one of the first apps in 2009 trying to use sounds to improve sleep, and I've gone on this whole journey on how to actually solve this problem of improving every human being's sleep, and it's been driving me for 15 years now. I know basically what's driving me is I know it's possible. I know that you can use technology to make every single night of your sleep deeper than it would be without the technology. The problem is it's hard, and oftentimes tech, as you know, and I've talked to you and the professor you work with about how tech can often do more harm than good.
Sure,
so this is the tension and the tightrope walk that we're trying to navigate. And I think we finally have a solution.
And how is that solution going to look for us in the future?
So I see three, maybe 4 main modalities. Sound, light, temperature are the main 3, and sort of vibration, which is maybe a part of sound. Tactile is maybe the 4th. But just big picture, thinking about the sleep sanctuary. That's your sleep sanctuary, and a big part of cognitive behavioral therapy for insomnia, as you know, is associating your bed with sleeping. And we do all these things to do that, cold, dark, quiet bedroom is what they say. But what if you could do more to do that? What if you could use technology to prime different states, literally changing your body temperature when it needs it, blocking out noise when you need that, maybe playing certain noises when you need to calm down. There's a lot of things that you could do. And then obviously waking up with lights and having a smart alarm and all that jazz. So that's the vision. A lot of people
have it. It's a great vision.
Yeah.
Personally, we and our team, we also have it as well. And, sleep is a big area of our lives, and it's just going upwards, I think, in terms of research, in terms of popularity and awareness in society. What is your current understanding of how sleep affects our cognition?
Yeah, so I started out doing artificial intelligence models actually for the Air Force and the Navy, to try to figure out how fatigue affects cognition. We use mainly eye tracking technology and something called a vigilance task to figure out when people get tired over time. Basically, if you're tired from a cognitive psychology perspective, your brain starts producing these microlapses of attention. It's thought to happen due to fatigue of the basal ganglia, which is sort of this pattern matching sensor in the brain. So sort of imagine, this is the way that I think about it. I'm a cognitive psychologist, not a neuroscientist, so I don't know the anatomy as much. I have sort of a loose understanding of that.
Gotcha.
But I have an understanding of how the system is sort of working. So imagine you're like updating every 50 milliseconds. I'm just like checking for patterns in my environment. And based on that, I'm making a decision on what to do. I worked on something called activation of thought rational, which is a cognitive architecture that simulated.
Sounds very interesting.
It simulated all these modules and stuff like this. So we actually simulated these micro lapses of attention and, not getting enough sleep, being at the wrong time in your circadian rhythm. All these things form micro lapses of attention. You can actually quantify it in with something called perclose, which are sort of these eye closures you might not even be consciously aware of. Eventually you'll fall asleep, right? That's a long gap of attention. And so basically, since it affects your attention, it affects everything, but it also affects higher level attention, maybe more with, the studies showing that you're more likely to take risks, gambling and stuff. They have some good studies on that. You're even less likely to have a good sense of humor, which is thought to be a higher level cognitive
That's
function.
so true. That's actually very true. Yeah.
I mean, we can definitely relate to being cranky when we're sleep deprived and not getting the joke when we're sleep deprived. I think a lot of people in our society would maybe benefit from this, which is part of my motivation. But also, what I study in our laboratory where we collaborate with Penn State and the University of Arizona to try to show how improving people's sleep quality actually reduces conversion to Alzheimer's disease. And I know your lab is interested in that as well. And so that's through this whole process of how deep sleep in particular and REM work to deep sleep cleanses out the beta amyloid plaques that are thought to result in, it's basically like a galvanic cleansing system for our brains. And so that's what deep sleep is doing. And deep sleep and REM is how we integrate information into our long-term memories and personalities. So it's important.
It's very important. Yeah, that's a great answer. Coming back to SleepSpace, can you tell us about your smart bed platform and how it works and how people can benefit from it?
Yeah, so we have free software on iPhone and Android that'll work with various wearables. So we'll integrate with wearables through Apple Health and Google Fit. It'll integrate with like an Oura Ring. We have our own algorithm on the Apple Watch. But one thing we found was that maybe about 40% of people don't like to wear something while they sleep. A large percentage of people actually prefer to sleep naked, which I think is probably pretty
interesting. Yeah.
I usually sleep with my boxers. Every once in a while I'll go in the nude. But I think it's probably good to sleep with less clothing from a temperature regulation perspective. But so anyway, if you're not going to wear any clothing, you probably don't want to necessarily wear a wearable, even though I wear multiple wearables every night. I'm validating my algorithm. So that's why we invented this phone charger thing. So it just slides under the bed. It can also more directly deliver sound, which is something we're really interested in. And we don't, in our lab, we would deliver the sound by targeting it using earphones, because that can give a very precise sound, because there's no, distance plays a major role in your perception of sound. So you have to be really precise. And so to get a similar distance between the person every time, that's partly why we designed this mechanism. So it's a phone charm that slides under the bed and picks up on the micro motions of your bed.
How accurate is it?
So we're actually bootstrapping an algorithm right now. So I think we have, and we're publishing this and making it publicly available, this algorithm for the Apple Watch. I think we actually have the most accurate wearable, possibly the most accurate wearable algorithm on for a wrist-based or a ring-based device. Yeah. And that's on our Apple Watch. We're about to release a new version of that algorithm that's currently available now. And we're actually releasing that publicly so researchers and clinicians and everyone can see the error and the accuracy in the data. We're really good at detecting sleep-wake. So that question is complicated, right? So how do you define accuracy? So the wearables are really good at sleep-wake. Most people think about in terms of percentage. Us scientists think about area under the curve. I'm just going to sort of estimate from the area under the curve stuff as a percentage. I say they're about 95% accurate at detecting sleep-wake, and they'll max out at that, I think. And then for the stages, they're about 80% accurate, and they'll max out at around there.
Right.
We think we can combine multiple data sets from the mattress and the wrist and
the device,
and actually get it even better. And so that's what we've been working on.
So combined metrics could lead to 100% efficacy in a way.
Well, I think you'll never get 100% because you can't beat an 16 or 8
Yeah,
channel, 16
you
channel
cannot beat
electrodes at
the PSG.
Yeah, you can't beat the PSG.
Yeah, you also do sleep coaching, right, as part of SleepSpace. Can you explain to us in layman's term, like, why do we need a sleep coach? What's the benefit?
Yeah, I mean, I actually think that there's more benefits to a sleep coach than a lot of like nutritional, in some cases, than some of the nutritional and like the trainers in a gym. Just because the suggestions that we'll make to people, we'll do it over like 2 to 3 sessions, but the suggestions can be maintained for your entire life. So, whether it's a simple thing like putting blackout stickers over the lights in your room to make sure it's totally dark, you do that one time and you have a behavioral solution that could change your life. It's not like getting coached when you're working out and, you're working on your form every time. It's something different. Like we're trying to give solutions that you just do this solution once and it's pretty easy to just keep on doing it every single night forever after.
So you only need to see a sleep coach for one-time consultation?
We have usually, I think it's most effective in 2 to 3 sessions.
2 to 3 sessions, okay.
So it's like an onboarding, like figuring out what's working, and then a final tweak iteration where we give the final feedback. And we've worked with a bunch of like psychologists, the top cognitive behavioral therapists. And the hard thing with sleep is knowing where the person sits and what could best benefit them, I guess. And so
got it.
Yeah.
All right. My next question is, you're heavily involved in research. What's your involvement in research now? What kind of grants are you applying for to help you with the company and to achieve your goals, basically?
Yeah, so in the States, they have these things called small business investment research grants. So a company who helps the public good can actually get these grants. And one of the biggest things that the public is going to be facing in the next 20 years is Alzheimer's disease. It's actually probably going to be the biggest cost to the healthcare system in the next 20 years as the baby boomers age out.
Right.
And there's this new research from fMRI, from mouse studies showing how sleep is so essential to reducing conversion to Alzheimer's disease. And we've tried to show that we can increase delta wave sleep with sounds. We'll bring someone into a sleep lab, look at their brain waves, and systematically deliver sounds to them.
What kind of sound do you deliver? Is it audible or is it...
Yeah, so it is audible. It's sort of a whooshing sound in the same pulse rate as your delta brainwaves. And we were able to show in a peer-reviewed publication that everyone is available on our website. You're welcome to check it out. We were able to show that we could increase delta wave, but I wasn't totally convinced in the cognitive improvements. Like we gave people cognitive assessments afterwards. So we moved on to using it in a way that sort of was more practical in the person's home, because we used this system where someone stayed up all night, looked at their brain waves, and systematically delivered the sounds.
Got it. Okay.
So now what we're doing is bringing that into people's homes, and we're integrating with things that we know work more, things that are less experimental. So we just kicked off a clinical trial where we're going to be running it on 60 years old or older in a clinical trial where we're comparing standard cognitive behavioral therapy for insomnia. So these are people who suffer from insomnia.
Right.
And when you have problems falling asleep and staying asleep, the recommended solution actually isn't a sleeping drug, as you know. It's therapy, behavioral change, changing your thoughts, feelings, and behaviors when it comes to sleep. And Daniel Taylor is the professor we work with who created this 6-week cognitive behavioral therapy for insomnia program with us. And what we're doing is we're comparing his typical treatment when he sees someone.
Standard treatment.
Yeah, with his treatment plus ours. So we're essentially empowering the coaches, empowering the clinicians. And if anyone of your listeners is a coach or a clinician who works with sleep, I would love for them to reach out to me.
Of course.
We're trying to make this system where you have more control as a coach on setting the person's bedtime and setting their suggested wake-up time for the week, which will then control smart lights in their home environment, adjust sounds, adjust a series of notifications, and also has a standard digital sleep diary, which is important to a lot of folks.
Yeah, absolutely. And making your phone more useful at night. as well.
Yeah, making it so also you're not scrolling aimlessly through Twitter or whatever, because that is so often an issue nowadays, and we actually quantify
Blue light
that.
from the phone. Yeah.
Yeah, the light from the blue light is not good, but honestly, more than the blue light, just the act of engaging with a phone in that way is just sort of stressful. It's a lot more stressful, actually, than passively watching a television show.
I agree. You know what I actually did in my bedroom? I usually have my phone charging next to my bed, so I ended up getting a digital clock, just a clock, putting it next to my bed just for the alarm, and I put my phone on my desk, far away from me.
Yeah, so the problem with the digital clock, though, is the light from it, no?
You can dim it, so I dim the light all the way down. Yeah.
So the smart bed that we have, you can put it on the foot of your bed, so the phone is also out of reach. And honestly, it's sort of good just to have the phone out of sight, because you're less likely to be primed to use it. But
out of sight, out of mind.
Yeah, exactly.
Yeah.
I think that's smart how you set that up.
Yeah, for sure. All right, I guess these are the main questions that we had for today. Dr. Gartenberg, do you have any last words for the audience?
My last words are, imagine if you could sleep 5% better, and what could you do tonight that could maybe help you sleep 5% better? Whether it's making sure you get more sunlight during the day, getting the dog or cat not to sleep with you at night. There can be something
major
weird
problem
that you might not think of. What can you do tonight to improve your sleep?
Got it. Yeah, and I think people should start asking themselves those questions, because a lot of people don't think about these things. Like we just go to sleep when we're tired. We're just going to sleep to sleep. It's like we don't think about it. It's part of our lives, but it's very nice to be aware about it and work on improving it. Dr. Gartenberg, thank you so much for joining me on today's episode, and we'll see you guys on the next one. Take care.